Good morning, everyone. I'm excited to welcome you all to today's presentation. We will be exploring the important topics of comfort, rest and sleep, pain, and promoting safety in the healthcare environment. This is part of our First Year B.Sc Nursing Foundation course under the KUHS syllabus. Over the course of this presentation, we will discuss key concepts and strategies related to creating a safe and comfortable environment for patients. Let's get started. Let's talk about comfort, rest, and sleep. Comfort refers to a state of both physical and mental well-being, which is essential for overall health. Rest, on the other hand, is when the body is inactive or only engaging in mild activity, allowing it to recover and rejuvenate. Sleep is a natural and reversible state where responsiveness to external stimuli is reduced, giving the body a chance to heal and restore energy. It's important to understand that both adequate rest and sleep are crucial for healing, tissue repair, and maintaining emotional stability. As nurses, our goal is to promote comfort, relaxation, and proper sleep because they play such a vital role in a patient's recovery and well-being. So, by supporting these aspects, we help our patients recover faster and feel more balanced overall. Now, let's talk about the different types of bed making, which is an important aspect of patient care. First, we have the open bed. This type is prepared for an occupied patient who is expected to return soon or for a patient who has just been admitted. It's designed to be accessible and comfortable for the patient while they are in the bed. Next is the closed bed, which is prepared after a patient has been discharged. This ensures the bed is clean and ready for the next patient. It's important for maintaining hygiene and efficiency in the ward. Then we have the occupied bed, which is made while the patient is still in the bed. This requires careful handling to ensure the patient's comfort and safety during the process. The post-operative bed is specially prepared for patients returning from surgery. These beds are arranged to support the patient's recovery and prevent any discomfort or complications. We also have the cardiac bed, which is designed to facilitate comfort for patients with cardiac conditions. Typically, these beds are set at a high Fowler's position, which helps with breathing and circulation. Finally, the fracture bed is designed to support patients with fractured body parts. It minimizes movement to prevent further injury and promote healing. Understanding these different types helps us provide the best care tailored to each patient's specific needs. Let's take a closer look at the open bed concept. When we talk about an open bed, we're referring to a setup that allows for easy access and versatility, especially in healthcare or transport settings. The key point here is that an open bed provides flexibility. It's easier for caregivers to perform procedures, for patients to get in and out, and for equipment to be used without obstructions. This design is especially important when safety and efficiency are priorities. It also supports the overall theme of creating adaptable and user-friendly environments, whether in hospitals, emergency services, or even in logistical operations. By understanding the benefits of an open bed, we can see how it enhances operational flow and improves outcomes. It's a simple concept, but one that plays a crucial role in optimizing care and functionality. Let's talk about a closed bed. When we refer to a closed bed, we're talking about a bed that is fully made up and ready for a patient. This usually means the linens are neatly arranged, the blankets are properly folded or spread, and everything looks tidy and professional. The key point here is that a closed bed signifies that the patient has been cared for and that the environment is clean and organized. It's a visual cue of readiness, comfort, and safety for the next patient or for the patient who will return. In the broader context of patient care, maintaining a closed bed is part of upholding hygiene standards and ensuring a welcoming environment. It also helps prevent infections by keeping linens clean and intact. So, when you see a closed bed, remember it reflects the overall quality of care and attention to detail that's essential in healthcare settings. It's not just about appearance, it's about creating a safe, comfortable space for recovery and well-being. Let's talk about occupied beds. This is a critical measure in healthcare because it directly reflects how busy a hospital or facility is at any given time. When we refer to occupied beds, we're talking about the number of beds that are currently in use by patients. It's a straightforward, yet vital indicator of patient volume and resource utilization. Understanding occupied beds helps us gauge workload, staffing needs, and even predict future capacity requirements. It also ties into overall patient care quality, because a high occupancy rate can impact the level of attention and resources each patient receives. Throughout this presentation, we've been emphasizing the importance of efficiency and effective management in healthcare settings. Monitoring occupied beds allows us to identify trends, optimize bed turnover, and improve patient outcomes. So, when we look at occupied beds, we're really looking at the heartbeat of the healthcare facility, how many people are being cared for at any moment, and how that influences all aspects of operational planning. Let's take a closer look at the post-operative bed. This is a crucial part of patient recovery, as it provides the immediate environment for rest and monitoring after surgery. The key points here are ensuring the bed is comfortable, properly equipped, and positioned to support healing. It's important to keep the bed clean and organized, minimizing infection risks. Additionally, the positioning of the patient in the bed can influence circulation and comfort, so adjustments are often necessary. This stage connects to the overall theme of patient-centered care, emphasizing safety, comfort, and effective monitoring during recovery. Remember, a well-prepared post-operative bed is fundamental to promoting a smooth and safe recovery process. Today, I want to talk about the cardiac bed, which is a crucial component in cardiac care. The cardiac bed is specially designed to support patients with heart conditions, providing a safe and efficient environment for monitoring and treatment. It's more than just a regular hospital bed. It incorporates advanced features like adjustable positioning to optimize cardiac function and comfort. These beds often include specialized monitoring systems, allowing healthcare providers to keep a close eye on vital signs and quickly respond to any changes. The overall goal is to enhance patient outcomes by ensuring they receive tailored care in a comfortable setting. Connecting this to our broader theme, it highlights how the right infrastructure and equipment are vital in delivering effective cardiac care. Let's take a closer look at the fractured bed. This term refers to a situation where the Earth's crust is broken into separate pieces, or blocks, that move relative to each other. These fractures can occur at various scales, from tiny cracks to massive fault lines. The key point here is that these fractures are significant because they influence how stress is distributed within the Earth's crust. When stress accumulates along these fractures, it can eventually lead to earthquakes. Understanding the fractured bed is crucial because it helps us grasp how energy is stored and released in seismic events. It also ties into the overall theme of how Earth's structural features govern seismic activity. Recognizing these fractures allows us to better predict and prepare for potential seismic hazards. Now, let's talk about comfort devices. These tools are essential in helping patients feel more comfortable and promoting rest, which is a key part of their recovery. For example, pillows are commonly used to support different parts of the body and help maintain proper alignment, reducing strain and discomfort. Overbed or cardiac tables are very versatile. They can be used for feeding, reading, or other activities that require a stable surface, making daily tasks easier and safer. Backrests are also important. They provide support when a patient is sitting up in bed, helping to prevent back pain and improve posture. Lastly, bed cradles are useful for keeping bed linens off tender areas or injuries, which can help prevent further irritation or damage and promote healing. Overall, these comfort devices are designed to enhance patient well-being, support proper positioning, and align with the overall goal of providing holistic and compassionate care. Pillows are often overlooked, but they play a crucial role in our sleep quality and overall comfort. When choosing a pillow, it's important to consider factors like support, firmness, and material. A good pillow should align your head and neck properly, helping to maintain spinal alignment throughout the night. Different sleep positions require different types of pillows. Side sleepers, for example, might need a firmer, thicker pillow, while back sleepers often prefer a softer, more supportive option. Material is also key. Memory foam, latex, and down are popular choices, each offering unique benefits in terms of support and breathability. Remember, the right pillow can reduce neck and shoulder pain, improve sleep quality, and even influence your mood and energy levels during the day. So, investing in the right pillow is really an investment in your health and well-being, which ties back to our overall theme of optimizing sleep for a healthier life. Let's take a closer look at the cardiac table. This slide summarizes some of the key aspects of cardiac function that are essential to understanding overall heart health. As you can see, it highlights important parameters like heart rate, rhythm, and conduction pathways. These elements are fundamental because they tell us how effectively the heart is pumping blood and whether there are any irregularities. For example, monitoring the heart rate helps us determine if the heart is beating too fast, too slow, or within a normal range. Rhythm analysis allows us to identify any arrhythmias that could compromise blood flow. The conduction pathways are crucial because they coordinate the timing of each heartbeat, ensuring efficient contraction. Connecting this to the overall theme, understanding these cardiac parameters is vital for diagnosing, managing, and treating heart conditions. It helps us identify issues early and tailor interventions accordingly. So, this table isn't just about listing facts. It's about understanding how these components work together to maintain a healthy, functioning heart. Let's take a moment to focus on the backrest, which plays a crucial role in maintaining proper ergonomics. When we're sitting for extended periods, a supportive backrest helps keep our spine aligned and reduces strain. It's important that the backrest is adjustable so it can fit the natural curve of your spine, providing adequate lumbar support. This not only enhances comfort, but also prevents long-term issues like back pain. Remember, a well-designed backrest is a key component of creating a healthy, productive workspace. It ties into our overall goal of promoting well-being and efficiency in our environment. Let's take a closer look at the bed cradle. A bed cradle is a simple but effective device used historically to prevent sheets and blankets from pressing down on a patient's legs or feet. It basically creates a sort of canopy or arch over the bed, keeping the bedding elevated and away from the body. The key point here is that it helps reduce pressure and discomfort, especially for patients who are bedridden for long periods. This device highlights the importance of comfort and pressure management in patient care, which ties into our overall theme of improving patient outcomes and well-being. By preventing pressure sores and promoting better circulation, bed cradles played a significant role in enhancing comfort and reducing complications, especially before more advanced mattresses and support surfaces were available. So, in essence, the bed cradle is a simple yet vital tool that underscores the ongoing effort in healthcare to minimize patient discomfort and prevent complications through thoughtful, non-invasive solutions. Now, let's discuss some common therapeutic positions and their purposes. First, we have the supine position, where the patient lies flat on their back. This is often used for general rest and basic examinations. Moving on, the Fowler's position is semi-sitting, which helps improve breathing and enhances comfort, especially for patients experiencing respiratory issues. Within Fowler's, there are different levels. Low Fowler's at 15 to 30 degrees, semi-Fowler's at 30 to 45 degrees, and high Fowler's at 60 to 90 degrees. These variations allow us to adjust according to the patient's needs. Next, the lateral position involves lying on one side, which is particularly useful for preventing bed sores and promoting pressure relief. The prone position, where the patient lies on their abdomen, is often used for spinal alignment and certain respiratory treatments. Then we have the Sims position, which is a semi-prone position, typically used during rectal examinations and administering enemas. Moving to the Trendelenburg position, where the patient's head is down and feet are elevated, this is mainly used in cases of shock to improve blood flow to vital organs. The dorsal recumbent position involves lying on the back with knees bent, making it suitable for perineal care or examinations. The lithotomy position, with legs raised and feet in stirrups, is primarily used for gynecological procedures. Finally, the knee-chest position involves kneeling with the chest down, which is often used for rectal or sigmoid examinations. Understanding these positions is crucial because each one serves a specific purpose in patient care, ensuring comfort, safety, and effective treatment. Connecting these to the overall theme, proper positioning is fundamental in nursing practice to promote healing and prevent complications. Pain is an unpleasant sensory and emotional experience that we associate with actual or potential tissue damage. It's something everyone encounters at some point, and understanding it is key to providing good care. There are different types of pain we need to recognize, including acute pain, which is usually sudden and short-term, chronic pain, which persists over time, referred pain, which is felt in areas away from the actual source, and phantom pain experienced after the loss of a limb or body part. When assessing pain, we look at several important factors: the location of the pain, how intense it is, how long it lasts, its quality or character, and what makes it better or worse. This comprehensive assessment helps us understand the pain better and tailor our interventions accordingly. We also have various tools to measure pain, such as the numeric rating scale, where patients rate their pain from 0 to 10, the visual analog scale, which is a line they mark to indicate pain intensity, and the Wung-Baker Faces scale, often used especially with children, where they select a face that best represents how they feel. In terms of nursing measures, positioning is crucial, adjusting the patient's position to reduce discomfort. Diversional therapy can help distract the patient and lessen their perception of pain. Relaxation techniques, such as deep breathing or guided imagery, also play a significant role. And of course, administering analgesics as prescribed is essential to manage pain effectively. All these strategies come together within a holistic approach to pain management, aiming to improve comfort, promote healing, and enhance the patient's overall well-being. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about promoting safety in the healthcare environment. Creating a safe space is crucial because it helps reduce the risk of injury and infection for our patients. One of the key aspects is the care of the patient's unit. Maintaining cleanliness, staying organized, ensuring adequate lighting and ventilation, and providing comfort all contribute to a safer environment. Now, let's discuss some safety devices. Side rails are an important tool. They help prevent patients from falling or injuring themselves when they're in bed. Restraints should only be used when absolutely necessary, and always with proper documentation and supervision to ensure patient safety and dignity. It's also vital to perform fall risk assessments regularly. These assessments help us identify patients who might be more prone to falling, so we can take extra precautions. Speaking of prevention, simple measures like keeping the call bell within reach, positioning the bed in a low position, and encouraging the use of non-slip footwear can make a big difference in preventing falls. Overall, these safety practices are interconnected and support our goal of providing a safe, healing environment for every patient we care for.